Okay, now what if your person can't help you really at all, but you don't have lift equipment? There's several layers. When somebody can't move at all and they're very heavy, you can buy lift equipment that reaches over the bed, or Hoyer lifts can work also. But if you're at home and just doing turning and repositioning, there are ways to turn somebody by yourself and just get the task done without using the lift equipment. Now this is called a U-turner, and this is a lift sheet that's shaped like a U. It's for turning, and then I'll show you how to lift, because we've got Caroline in a good position now to show you how the U-turner lifts, and then I'll show you how to slide a person so that you get them where you want them exactly on the mattress. Okay, so of course Kelly's going to drop the mattress. The U-turner actually fits under one side under the shoulder, and you can just tuck it under her neck and under the pillow. And then the other side, you want to go down to the U and then tuck it under her legs. So lift up her knees. Then you can lift up the other knee if you can reach, okay, and get it as far under as you reasonably can without reaching or having too much force. Okay, and then you want to tuck under her body at least 3 inches. You just tuck it under there. You don't have to lift or anything. You just tuck it under there so that it's kind of lifting under her torso, her butt and her back. So then she's going to come around and pull the straps through and get it all the way under her shoulder on this side. And then pull the other end through so that it's close under her butt. And then you want to pull it up a little bit higher this way, so that, yeah. So you're pulling it under her butt. So it's lifting her, actually it's the upper part of her leg just below her butt, like near the sit bones. Then you throw the straps under. Now the straps are close to you, and Kelly can actually lift by the straps without bending her legs too much. Now, of course, you still want to have bend, at least bend the knee that's furthest away from you, right? Okay. You can bend both legs, it works okay, but at least this knee if you can. And sometimes you might have to help them bend. If they can't bend their knees, then they can't bend their knees. If they have a lot of hip pain, it's not a bad idea to put a pillow between their hips, between their legs, sorry. So that actually works pretty good too. Okay, now we've got her knees are more comfortable, and this is going to help her hips also. Okay, so she's going to look up. She's by herself. She's going to look up, but she is talking to her person, and she's saying, "Okay, we're going to turn on the side, right?
On 3, we'll turn. 1, 2, 3.
Okay, good. Now, you'll notice that she's able to pull them all the way over. We can actually sort of steady this so that it's nice and flat. Now, this particular one, the U-turner, has little clips that you can put on the other side and help your person stay there, because a lot of people can't stay in this position, and when you let go, they flop back over. So if that's happening to you, you can clip this, but it's only long enough so that you can do the peri-care that you need to, and then maybe change the linens or whatever. Now, before Kelly walks away, she's going to have to raise the rail, right? She can clip this, but she can raise the rail so that we don't have any accidents, all right? So we'll turn there. She's going to clip to hold the person if the person can't stay there. And we won't go into that because it's too detailed for here. Okay, now, so we can clean a peri area. Now, let's say she's got this soiled linen, and we have to change the pad. So we want to roll this, roll, don't tuck this way, roll the pad all the way, and after you get everything clean, and tuck it in as far under here as you can. Then get your fresh pad and roll the fresh pad so that it's down here. And we got to roll, and we actually tuck the fresh pad. This one's green because it's a little bit bigger. Now we want it to absorb from the peri area down. So we don't want to put the pad all the way up against her back. We want to put it down here so that the moisture is pulling this way. Okay? So then you tuck under here. Now, if you have a lot of moisture and you have a lot of problems with moisture, there's no reason why you can't put 2 pads under here. But for sake of demo, we can just put one pad. Okay, so now we're going to tuck it under there, really as far as we can, and make sure it's covering the rest of the mattress this way. Okay, now Kelly can unclip. We're all done here. Now, we can, if we want, we can place the cushion now, but it is going to be a little bit more tricky. But if you want, if you're not having to boost her or anything, you can put the cushion in now, pull the clean linens through, and then you've got her turned. But for the sake of the demonstration, we're going to show you how to boost and position a person that can't move in bed also. So now we got the turn. Okay, so now we're going to let the boosters roll. Now she doesn't roll back on her own. You can just gently push. It's really not very much stress. Okay, and then before we take this out, we're gonna I think it's gonna end up here. You can actually pull the linens through. You roll the linens back towards you. Don't pull them out straight. Roll them back, otherwise you'll have a big mess on your hands. Okay, and then just reach under and we'll get the rest of that. All right. Now, let's say, okay, so like, which happens a lot, we're cleaning, we want to focus on the cleaning first, and now our person's actually out of position. So we need to use a slider to turn it. Now these are, there's a lot of sliders out there. This one happens to be called the Sally Slide. And it's kind of like a plastic bag. It's open, but it's very slippery, so you can really slippery on it, okay? So I'll put this in a loop style all the way under her, and we'll get it under her, and we can actually move her. Even just one person can do this because it's so slippery and it doesn't cause any dragging. All right, so Kelly, go ahead and pull her back over so we can put it under her. Oops, it got stuck. Oh, good. So Kelly came around, and then when she comes around again, she's not going to forget to drop the rail. See, turning and repositioning is not a quick operation sometimes. When the person can't help you, it does take some time, so you have to account for that. All right, so we got the positioner. Now we're going to roll the rail down, and we're going to tell our person, Caroline.
All right, Caroline, on 3, we're rolling. 1, 2, 3. Good.
Okay, good. Now, if Kelly was by herself, she could raise the rail and clip those things and get them under there. Always, so maybe if Caroline can stay in this position, we want to raise the rail no matter what, but let's get going with this. So I put this slider sheet under here, under her whole back and her whole torso. All right, we just kind of tuck it in. It doesn't have to be pretty. Never, never, never leave this under the person. We're keeping it there just long enough to achieve what we want to. Okay, come on back, Caroline and Kelly. All right. All right, now, if you're by yourself, you might want to just tuck it in a little bit, but you should be able to reach and get the slider, the rest of the slider from under her, because I've tucked it way under her. Okay, now, we'll do the 2-person since we're all set up for that now. Okay, so she's actually nice and high up on the head of the bed. You can see that now. So we're going to just, for fun, we're going to unboost her so that we can show you how easy it is. 1, 2, 3. Okay. All right. We actually, some of it, we had a little slack on there. So you roll up the top part and get that as close as you can. Now, there's nothing under her head now. So we can either do 2 things. If she can't lift her head, we're going to have to put the pillow under her head. Not like that, but okay, so we could either do that. Now, if she can lift her head, it's probably better to actually leave the pillow. Again, so sorry, I dropped your head. Leave the pillow up here so that when we slide her up, she runs into the pillow and not the rail. Okay, so let's lift up your head. If you want to lift up her head, use the flat of your hand if you need to. And we'll put the pillow all the way under there. Now, always bend the knees when you boost. If you possibly can, you want to bend the knees. Now, we've got the pillow, which is no big deal, but okay, bend your knees, Caroline. I'm going to bend your knees, all right? And Kelly will bend the other knee. And you know, you can put socks in there or something to keep her knees bent. But this is very important because not only does it take a lot of weight off the boost, but it keeps from dragging your heels, which are the heels are very vulnerable to injury. All right, so now we're going to talk to Caroline again, and we're going to say, okay, Caroline, on 3, we're going to slide you up towards the head of the bed, okay? 1, 2, 3. Easy peasy. Easy peasy, Jeezy. Okay, now we've still got the U-booster under there, and we could turn this around. Now, if you go on the Sally Slide video, it says you can actually pull this out, which you can, but it's not really that easy. And if you have the booster thing under there still, then just turn her over. First, we can. Sorry, we can. Okay, so Kelly will turn up.
On 3, 1, 2, 3.
Good. Okay, and I'll just tuck this way under there, or I can probably even get away with, no, not in this case. Okay, I'll just tuck it way under there. It's very slippery, and so you're not going to hurt anything. All right, now we might as well set up the cushion here. I'm going to just keep tucking until I get it way under there. Again, Kelly can clip it if she needs to or not. Okay, now we're ready to position because we've boosted her exactly where we want her. Let's say it's, right here. Okay, this is going to be a great position and so comfortable. Okay, roll back, Caroline. Roll back. Okay, good. Now Kelly can easily slip the rest of that out from under her and take out the thing. And then, of course, we do the same thing with the pillows. We put the pillows between her legs and all that. Okay, so there you have it using a U-booster. Now, the heavy-duty lift equipment, things like a trapeze, which is it's called a trapeze, and there's a big bar, and there's a thing that hangs over here, and you can either strap lift equipment to it, or you can have your person grab a rail that'll allow you to help them. So that's a little more advanced. A Hoyer lift it's like a chair thing. I'm going to include some videos about that. And that can also be used to help reposition somebody and, of course, help them get out of bed. Okay. All right. So that's moving somebody who can't move themselves.